Hi, my name is Dan Feldman. I live in Shaker Heights, Ohio. I'm a 38-year-old husband and father of 3 children, ages 5, 3, and 1. And I have terminal brain cancer. Specifically, it's called glioblastoma. Here to talk today about how healthcare reform is vital to my existence and my family's continued existence. In May of 2010, just 7, 8 months ago, I was diagnosed with the glioblastoma, and the statistics on it are very dismal. The average lifespan after diagnosis is about 14 months. And only a handful of people live past 3 years. I was, at the time that I got this, I had insurance through Cobra that covered both me and my family. And then through the course of my treatment, my Cobra benefits were going to run out, specifically December of 2010. So knowing this was going to happen, and knowing that I have terminal cancer and very big bills, medical bills, to pay every month, I went searching for a suitable insurance plan that would cover me. And there were really hardly any options out there at all. There was a conversion plan from the policy that I had that covered very little and would have cost about $50,000 a year, something I certainly can't afford. There was a high-risk pool, which required me to not have insurance for 6 months in order to qualify, which when you have terminal brain cancer, you can't not have coverage for 6 months. And then I did finally find a program that is an outgrowth of the National Healthcare Reform Bill that covers people with pre-existing conditions. It is an expensive plan, and by that I mean it costs us a couple $1,000s a month for the family and myself, but in the face of tens of $1,000s a month, it actually is relatively inexpensive. It is this program that's keeping my health care alive. Without health care, again, my condition, generally people die within 3 to 6 months. And so this program, while it has its problems, is actually keeping me covered and keeping me alive. And I am talking today to stress the importance of fixing our healthcare system, specifically insurance companies and how they cover people with pre-existing conditions. If this doesn't get solved, every day that we as a country and as a government are bickering about the legislation, every day that happens, as opposed to us working together just to fix it, people are dying. And I will die if we don't fix this problem. And I'd like to thank, and by fixing it actually, I'd like to say the keys are making coverage affordable for people with pre-existing conditions, and actually for everybody. Making the insurance companies accountable and having transparency in their coverage. And making that coverage accessible to everybody, and making quality health care accessible to everybody. And so that's what I am trying to help an organization called UHCAN Ohio do, both here in Ohio, but also hopefully cascade across the country, to put a face on what this healthcare debate is really all about. And so I thank the people at UHCAN Ohio and everybody listening for helping me with my cause.